weight if you're noticing a pattern where the levels are creeping up. Let's move on to high blood glucose levels or hyperglycemia and the reasons behind why these occur. As previously mentioned, your insulin doses will need to be reviewed up the way in terms of increased as your child grows. It may be that there's a mismatch in terms of your carbohydrates, either estimated or consumed. It's quite common to overreact to a low blood glucose and treat it with too much sugar and for it to overcorrect and shoot the levels high. Stress, anxiety, excitement also contribute to glucose levels. Delayed or missed insulin doses can clearly lead to high levels. And sometimes, despite your best efforts, there's no obvious logical reason why a glucose level might be high on any specific occasion. The symptoms that you may see include increased thirst, peeing or going to the toilet more often, feeling tired and lethargic, or headachy, mainly due to high dehydration. Some of you will be familiar with several of these symptoms from before it was diagnosed. Let's move on and look at diabetic ketoacidosis in more detail. Again, some of you will have experienced this and it will have been likely a traumatic introduction to type 1 diabetes. It involved your child being attached to drips and monitors and spending time in hospital. Roughly a third of new families where the child's been diagnosed with type 1 diabetes present in this way, meaning that the majority generally are picked up earlier with mild symptoms of drinking more, and peeing more, and perhaps some weight loss. However, DKA is usually preventable and very risky acute complication, which arises from a lack of insulin. And if you see this pattern, you must seek help appropriately. It can often be driven by intercurrent illnesses that arise throughout childhood, which just tips the balance. What are ketones? Well, ketones are produced by the body in response to high blood glucose levels. This is driven by a lack of insulin. Insulin, as described in the video, is required to release glucose from your circulation to your cells to be used as energy. If this can't happen due to a lack of insulin, your body very cleverly tries to compensate by using other fuel sources. The breakdown of fat is another fuel source, which in turn can cause the production of ketone bodies. If this is left unchecked and ketosis develops, it can tip over into acidosis, which is a much more alarming and life-threatening complication. You will have a facility for checking glucose ketones by using a different strip in your meter. In addition to checking for blood ketones, you will see some of the symptoms already mentioned in relation to high glucose levels. These include feeling nauseous or sick, actually vomiting, having stomach cramps or pains, and a much later sign is a change in your respiratory or breathing pattern called kusumil or sighing breathing. which is your body's attempt to reduce the acidosis that is developing. Some people can smell an acetone or pear drop smell on the breath of the person who is developing DKA. A red flag for us is always vomiting. Obviously, you can vomit for lots of other reasons, gastroenteritis, food poisoning. However, in the context of type 1 diabetes, it should always be assumed to be driven by ketones until proven otherwise. In these circumstances, you should contact the diabetes team during office hours, or if unavailable or at weekends, by dialing the Children's Ward, Ward 29 at Tayside Children's Hospital on their direct dial, which is 01382 633 829. Ketosis and acidosis is not something that can be safely managed at home. So checking for ketones isn't something that you'll routinely be expected or need to do, but it's good to have a habit of checking for ketones if you've had a couple of high glucose levels in a row over a few hours apart for unexplained reasons. So as previously mentioned, often you can work out why a glucose level is high, perhaps unwashed hands, mismatched insulin, extra food that hasn't been accounted for. However, it's good practice and our recommendation if you have a couple of readings that are over 14 as shown here or high for you in the context of where your levels normally sit, it's imperative that you check for ketones. And this is something that if you are contacting the ward out of hours, they will likely ask for the blood ketone result. One of the times where you would be checking more routinely for ketones and more frequently would be during times of illness. Your Smart For Sure duometer has a separate ketone with each pot containing a calibration stick that you present first when you pick up each repeat prescription, which will facilitate you to check for blood ketones. Interpreting the results is shown here in a sort of traffic light system. So it's important to know that anything below 0.6 is not too much of a concern. If we move on to the amber zone, between 0.6 and 1.5, it may indicate that you need to do an extra corrective dose of insulin, or certainly be keeping a closer check on things with more frequent checks. If it's over 1.5, then it's likely that you're already somewhere down the road towards DKA, and you should definitely seek help immediately and not try to deal with this at home. So without scaremongering, please always treat DKA as an acute complication which requires review at hospital and is a medical emergency. So in terms of preventing DKA, the key messages are to try not to be late or to miss insulin doses on a regular basis, to seek help sooner rather than later if things are trending in the wrong direction, or if you are unsure or just looking for reassurance during times of illness. Check for ketones if you have too high glucose levels over 14 over a few hours apart for unexplained reasons. Vomiting is always a red flag. And then the general principles of nursing you through any intercurrent illnesses would be to keep well hydrated, not to stop giving insulin, It may be that you end up needing less fast-acting food insulin, but you should always keep going with your background insulin. And in fact, in the context of infections and some illnesses, you will actually have to give more than usual both types of insulin to manage high levels.